Minister, good to see you. Thanks for your time as always. Now, before we get on to reflections, I'd like to ask you about Omicron and just whether you have been given any more information or any more data as to its power and its potential danger.
Sure. So obviously we've taken a very cautious approach in the difficult decision but immediate decisions to close the borders to the 8 Southern African nations, to require Australians who are returning home to go into full 2-week quarantine. However, we've done that on the basis of determining the international evidence. The emerging early international evidence, so it's too soon to be definitive, is that we know that it is likely to be highly transmissible. There are signs that it may be milder, but that is still to be determined. I need to be very clear on that. And then on the vaccine resistance to the disease, it appears as if there is still good resistance, strong resistance, but it's too soon to make a definitive call on that. The cases in Australia, the 9 cases, now 8 in New South Wales, 1 in the Northern Territory, on all the advice I have, are either asymptomatic or mild. Now, obviously, they have to run the course of their infection, but at this stage, there are some reasons for cautious early optimism, but we've taken precautionary decisions to protect the country.
Right, so can you give any guarantees at this stage that the current 14-day pause on migrants and international students will be it?
No, I'm certainly not making any guarantees. It's our intention at the end of that period, subject to the science and the medical advice, to return to the previous settings. But our job is to review that international science. It's the same period as the United States, as President Biden said they would be taking. And so it will depend on the international evidence. And I'm sorry for any inconvenience and difficulty for people, but making these early decisions are the very things, going back to the closure of the borders with China, which have protected Australia throughout. So we have to do that. Again, another $500 million today for extension of COVID measures during 2022, pathology testing, the National Incidence Centre, research into long COVID and other conditions. So we just keep going, keep protecting Australia and adapt as we have to, but with a clear national plan. That's the direction, to progressively open up. But if we have to take interim measures to provide that protection, we won't hesitate.
Right. You had the boss of Moderna this week saying that he believes that a new vaccine will be needed to tackle Omicron. I mean, have you had conversations with the vaccine bosses this week? And if so, what sort of indication are they giving you?
So I've spoken with Moderna, Pfizer, Novavax this week myself. And the situation at the moment is we believe that there will be good protection. We want everybody to have their primary vaccinations, which is the first and the second dose. And if you're due for the booster, do not delay. Please come forward. We're at well over 470,000 boosters and 92.6% of first vaccinations around the country. And if there are variant-related vaccines that are required, we're in a position to do that. We've already spoken with both Pfizer and Moderna about those, and I was speaking with Novavax yesterday, and that's making very good progress through its medical regulator or TGA assessment in Australia. So we're well prepared. We've got deep stocks of vaccine, capacity to have access to
but you won't need a completely new vaccine.
The same way that the flu vaccine evolves. If they were to vary it, it would obviously be the same base vaccine, but with variations to deal with changes in the nature of the spike protein. Yeah. And so we're ready. We're in a strong position. But if you haven't been vaccinated, please come forward to be vaccinated. 92.6 is one of the highest rates in the world, but we'd like it to be higher again.
Minister, it was a chaotic, at times shambolic final sitting week of the year. Libs and Nats crossing the floor, multiple resignations for a variety of reasons, but there's been scandals. dog noises, the whole lot. A lot of criticism coming in for Parliament this last week. How can you govern with the party in such disarray?
Look, I respectfully disagree with that characterisation. At the end of the day, here we are announcing another $500 million for COVID extension measures, keeping the country safe, seeing the international forecasters upgrade Australia's expectations for economic growth from above 3% previously to above 4% for next year, bringing people back into work, bringing people back home. All of these things are what we're actually doing. I had yesterday major landmark pharmaceutical benefit scheme legislation passed the Senate. We had Maeve's Law for mitochondrial disease through a magnificent, beautiful conscience vote passed the House of Representatives on Wednesday by a majority of 3-1, of 91 to 29. And so the work of the Parliament is ongoing. And the really interesting thing, as I reflect on my time, knowing I've got an immense amount of work to do over the next 6 months, is throughout this pandemic, the Treasurer and the Prime Minister, they've always known the way. They have an innate sense of the Australian people and they trust in them, and that trust has been returned. And so that relationship has meant that of all the nations in the world, Australia has one of the highest vaccination rates, one of the lowest rates of loss of life, and one of the strongest economic recoveries. The big things that are protecting Australians are happening, and that leadership of the PM and the Treasurer, it's really a fine team with a great sense of the nation and an understanding of the direction.
Minister, you're of course leaving politics after 20 years. Yesterday you cited family, which is fair enough, but it's surely been a slog for you. Are you also just out of steam? No, not at all. I'm up and out this morning, up at 5:30 to be out focusing on these new COVID extension measures. Between now and the election, focus on COVID, obviously, and protecting Australians and making sure that the systems we've established are there. A focus in particular on a new primary care 10-year plan, a rural health focus, medical research. We're developing the next iteration of our 10-year medical research plan to bring forward what are called personalised treatments, and mental health and aged care. And there's always more to do on mental health. I particularly want to focus on youth mental health and children's mental health. So it's going to be difficult to jam it all into that time. So from my perspective, it's about run. Will you be the next High Commissioner in the UK, Minister?
Honestly, I've not had any discussion with anybody. I saw that report. I haven't spoken with Scott or Josh about anything beyond Parliament. I'm just focused on this. I want us to win the seat of Flinders, win the election, because I believe deeply in the PM and Josh and the mission of giving Australians the best chance at the life of their choice. I literally have not focused. All I want to do when I finish is just take time to be a dad. Okay. And the rest will deal with itself. Between now and then, there's a heck of a lot to do. Okay,
so if the PM says to you, you're going to go to London, would you accept that?
Look, I won't even contemplate. This is I tell you who gets the first vote on the future. That's my wife, Paula. And right now, we want to try to be together, and my kids will want to see me. They might get tired of me after a little bit of time, but I want to see them and they want to see me.
Just a quick one. Would you like to see women pre-selected, not just in your seat, but also in the seat of Pearce as well?
Absolutely, I would. Absolutely. And I've seen candidates for Pearce that are really strong women, but it'll be a matter for the pre-selectors. I know there's the potential in my own seat, subject to the will of the party members who are the ones that pre-select, to have a strong, brilliant woman, and I would love to see a strong, brilliant Liberal woman pre-selected. And then we see in seats like Corangamite, Stephanie Ashner, the amazing Mayor of Geelong running for the Liberal Party, in seats like Dunkley, which is Frankston and Seaford and Langwarrin, Sian Coombs, who's been a criminal prosecutor and, again, an outstanding, strong, capable woman who's the Liberal candidate. And so we already have the highest number of women in Cabinet in Australian history. People such as Katie Allen and Amanda Stoker and Fiona Martin and Melissa McIntosh and Lucy Wicks, who are emerging as future strong leaders within the party. So it's the strongest female talent that I've ever seen. But then the incoming group, I think, is just transformative.
Just a quick one here, Minister. How many times have you seen The Princess Bride?
Too many. It was my university go-to film, and I love it. And to be able to cite it, somebody last night said that one of the TV stations took my comments about The Princess Bride and compared them with the actual comments, and that made my day. There were many things I enjoyed yesterday, but being matched up against The Princess Bride, that's a good day at the office.
Greg Hunt, appreciate your time as always. Thank you. We'll talk to you soon.
Take care, Pete.